Hello everyone, I am Dr. Siad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding.
In this video, we are going to see ICD-10-CM General Coding Guidelines. We are going to learn in two parts, Part A and Part B. In Part A, we are going to see the coding conventions. ICD-10-CM stands for International Classification of Diseases 10th revision clinical modification. So in this part, we'll see the convention for the ICD-10-CM. There are 19 elements available. The first one is the alphabetic index and tabular list. ICD-10-CM coding requires use of both. Alphabetic index is for search conditions alphabetically, and tabular list is for verify the codes, laterality, seventh character, exclude note. Those kind of things you can find in the tabular list. So when you compare the alphabetic index and the tabular list, the main function of alphabetic index is to locate the main term, but the tabular list is to verify and assign the code. When you compare the alphabetic index, the completeness, it is often gives 3 to 4 characters. But in the tabular list, it shows the full 3 to 7 characters requirement. When you see the alphabetic index, the sequencing slanted brackets suggest order, but in the tabular list, it will give the clear description, code first notes to maintain the order. But in the alphabetic index, it lists all matching conditions, but in the tabular list, it gives you the excludes 1 and 2 notes to forbid some conflicts. In the alphabetic index, there's no placeholders shown, but in the tabular list explicitly visualizes the need for the placeholder X. So in summary, alphabetic index is to locate the main term, and the tabular list is to verify and assign the specific code for the condition. In the alphabetic index, there are main 4 indexes available. First one is index for diseases and injury. Second one is index for the external cause of injury. Third one is table of neoplasms. Fourth one is table of drugs and chemicals. The second is format and structure. So the ICD-10-CM codes contain 3 to 7 characters. Usually the first character is the alpha character, that is A to Z, excluding U usually. U is now used for emergency use like COVID-19. And the second character is a numeric one, and characters 3 to 7 are the alpha or numeric. And a decimal point is always placed after the third character. So if you are fluent with ICD-10 code, you will understand what this means. For example, I-10 is a 3 character code. It's for the essential, that is primary hypertension. You can see another code S62.011A. So this is a 7 character code with the decimal point after third character. This is for the displaced fracture of distal pole of navicular bone of right wrist initial encounter. This is the full code for that scenario. Third, use of codes for reporting purposes. Code must be represent conditions documented by the provider and required for patient care or billing. For example, a patient has seasonal allergies but is not evaluated or treated for them during the visit. It is not coded. So you have to code what is the provider documented. Number 4, placeholder character, that is X. The X is used as the placeholder in certain codes to allow for future expansion or to fill empty spots so that the 7th character can be placed in the 7th position. For example, if you take a code T42.4X1A, this means poisoning by benzodiazepines accidental initial encounter. So here the root code is T42.4. To add the required one, that is accidental, and the A, that's for the initial encounter, you must fill the fifth position because this encounter is the 7th code. So when you without X, you can see 1, 2, 3, 4, 5, 6. A will come in the 6th position, but the encounter code should come in the 7th position. So to fill that gap, you had to use this X for X as the placeholder. So you will understand when you do the questions or the coding practices. Number 5, 7th characters. As I said earlier, certain categories, especially chapter 19, that is injury and positioning, and chapter 15, that is pregnancy, require a 7th character to specify the encounter type or features. The 7th character must always be in the 7th position. Some common 7th characters in trauma: A for initial encounter, that is for the acute treatment; D for the subsequent encounter, that is for the healing phase or the cast change; S for the sequelae or late effect. For example, the code S91.302A means open wound of left foot initial encounter. S91.302D mean open wound of left foot subsequent encounter. Number 6, abbreviations. You can see the abbreviations in the alphabetic index as well as in the tabular list. Let's look at the alphabetic index abbreviations. First one is NEC. NEC mean not elsewhere classifiable. The medical record is specific, but the coding book does not have a specific code for the condition. It represents other specified. For example, H57.8 is other specified disorders of eye and adnexa. So the doctor or the provider specified the disorder, but there isn't a unique code for it. So that says not elsewhere classifiable. Similarly, NOS, not otherwise specified. The medical record is insufficient or vague. It equates to unspecific. For example, J18.9 is pneumonia, unspecified organism. But the doctor or the provider did not document the type of bacteria or virus. You can use this code, that is unspecified organism. This for the not otherwise specified. Similarly, you can see this NEC and NOS in the tabular list of abbreviation. The tabular list uses the same NEC or NOS logic as above, as in the alphabetic index. 7. Punctuation. So these box brackets used in the tabular list to enclose synonyms or alternative wording. In the index, they identify manifestation codes. For example, G30.9 within box bracket F0 to 0.80. This indicates that if you code G30.9, that is for the Alzheimer's disease, you must also code F0 to 0.80 for the dementia as the secondary code. So you can see here the Alzheimer's disease, you can see this code with the box bracket, you can see the other code for the dementia. Other one is normal bracket parenthesis. Here enclose non-essential modifiers. These words can be present or absent in the medical documentation without changing the code assignment. For example, under I-10 you see hypertension, benign, essential, malignant. You can see here whether the doctor or the provider writes malignant hypertension or just hypertension, the code remains the same, that is I-10. Similarly, colons used in the tabular list after an incomplete term that needs one of the modifiers following it to make it assignable. So you will understand when you do the coding examples. Number 8, use of AND. When AND appears in a code title, it means AND or O. For example, you can see this code A18.0, that is tuberculosis of bones and joints. This code is used if the patient has tuberculosis of bones, tuberculosis of joints, or TB of both. So all conditions you can use the same code. Number 9, other and unspecified codes. Other codes used when the provider documents a specific condition, but the classification does not provide a precise code. For example, gastritis due to a specific new organism is not listed in the code book, so you can use K29.6, that is other gastritis. So the organism is not listed in the code book, so you can use this code. Similarly, unspecific codes used when documentation lacks details. For example, gastritis with no other details provided, so you can use K29.70, that is gastritis unspecified. So what kind of gastritis? There's no detail available, so you can use this code. So in summary, does the provider documentation provide specific detail for a condition? If it is no, report the unspecific code. If it is yes, is there a specific code for the specific condition? If it is no, report the other code. If it is yes, report the specific code. So you will understand when you do the examples. So number 10, include notes. So it clarifies content included in a category. For example, F10 to F19 includes mental disorders due to psychoactive substances. This is one type of include note. Other one is under some codes you can see. For example, under code I10, there is an include note that says includes high blood pressure. So these also one type of include notes. Number 11, inclusion terms. A list of terms is included under some codes. These are the conditions or synonyms that fall under the specific code. For example, under E11, you can see type 2 diabetes without complications. So here the inclusion terms are diabetes type 2 NOS, diabetes mellitus type 2 NOS. So those are the inclusion terms. Number 12, excludes notes. This is one of the most tested areas in the CPC exam. So learn carefully. So it have two parts. One is excludes what? This is mutually exclusive. So in summary, this is not coded here. You cannot code these two conditions together, but some exception there if the two conditions are unrelated to each other. For example, M54.2 is a cervicalgia or neck pain, has an exclude node for M550. You can see here the real code here. M54.2 cervicalgia. Here the exclude node says cervicalgia due to intervertebral cervical disc disorder within bracket M50 point dash. So this means you generally do not code neck pain if the patient has a cervical disc disorder, because the pain is inherent to the disc disease. You only code for the M50. So the patient coming with the cervical disc disorder, that neck pain is inherently included in that code. So you no need to code the M54.2 with the M50. So in that scenario, you only code this M50 point, the relevant code. Number 13, etiology or manifestation convention. Certain conditions have an underlying cause, etiology, and a body system manifestation. In that scenario, you have to follow following instructions. Code first, found the manifestation code, points to the etiology. Then use additional code found at the etiology code, points to the manifestation. In diseases classified elsewhere, indicate a manifestation code. So let's see an example. A patient with diabetic nephropathy coming with the stage 2 chronic kidney disease. In that scenario, first you had to code the etiology. So here is the etiology is the diabetic nephropathy. So E11.21, that is type 2 diabetes mellitus with diabetic nephropathy. Then the manifestation is the chronic kidney disease. So then you have to code. Secondly, you have to code the manifestation. The tabular list under E11.21 says use additional code to identify stage of kidney disease. Then you have to go for the kidney disease stages. So here you can see below the code, it says use additional code to identify stage of chronic kidney disease, that is N18.12 and 18.6. So this is the secondary code, second code. Number 14, use of AND. When N appears in the code title, it means NOO. As we seen in the number 8, the example of A18.0, that is tuberculosis of bones and joints, which means the patient has TB of bones or the TB of joints or the TB of both. Number 15, with. The word with or in the alphabetic index presumes a causal relationship between the two conditions. You link them even if the provider does not explicitly state due to. The guideline specifically requires documentation of a link, or if the provider explicitly states the conditions are unrelated, then you have to exclude that. So what it means, for example, documentation says patient has diabetes and chronic kidney disease. So normal scenario, the chronic kidney disease is the consequence of the diabetes mellitus. So the causal relationship, even though it's not mentioned, we have to assume that CKD, that chronic kidney disease, is due to diabetes. So the code assumes a link because CKD is listed under diabetes with the subterm with in index. So code E11.22, that is type 2 diabetes with diabetic chronic kidney disease. Number 16, C and C also. C, a mandatory instruction, you must go to the referred term. Example, in the index, hemarthrosis traumatic says C sprain. You cannot code hemarthrosis, you must look up sprain. But in the case of C also, it's a suggestion. Look here if you don't find what you needed under the first step. For example, index laryngitis, it says C also cope. If you cannot find the code in the laryngitis, you can also check the codes for the group. Number 17, code also note. This indicates two codes may be required to fully describe a condition, but this note does not provide sequencing direction. The sequencing depends on the circumstances of the encounter. For example, code G89.3 is for neoplasm related pain. The note says code also neoplasm. So we can take two scenarios. Scenario 1, a patient comes for pain management. So you can code G89.3 first, then the cancer code. Scenario 2, patient comes for the chemo. So here you have to code the cancer first, then the G89.3. Number 18, default codes. A code listed next to a main term in the ICD-10-CM index. This represents that the condition commonly associated with the main term. For example, the term appendicitis. So the default code is K37. The K37 code is unspecified appendicitis. So if the provider writes appendicitis with no other detail, K37 is the default code. Similarly, for the hypertension, the I10 is the default code. You can see I10 essential or primary hypertension. So if the provider marks as hypertension, you can use the default code I10. Number 19, code assignment and clinical criteria. Codes must be reflect provider documentation, not the lab findings alone. For example, lab shows elevated HbA1c, but the chart does not diagnose diabetes. So in this scenario, do not code diabetes unless the provided. Okay, but there are some exceptions like BMI, coma scale, and pressure ulcer stage can be coded based on the documentation from other clinicians, example nurses, dietitians, provided the physician has documented the underlying diagnosis like obesity or pressure ulcer. So this is the end of the part 1, that is for convention for the ICD-10-CM. See the description for the part B for the more general coding guidelines for the ICD-10-CM.
So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.